Hey guys, welcome to another UX healthcare session. And today we are going to talk about why healthcare is so difficult. Now, that's really it's a rhetorical question because I'm going to just go ahead and share my screen. So, for those of you that already know, I'm graduating with an MBA with a concentration in healthcare, and your boy's on track to becoming a Jack Welch Scholar that's graduating with distinction 4.0. And quite frankly, even though that's good and all, it's already been done in my family. So it's kind of like you just gotta you gotta meet the standard, right? Like my mom has an MBA and she's summa cum laude. She's got the 4.0 guys. So it's just meeting that standard, right? Now I'm saying all of that because even in this space, right, as you would consider me to be a high achiever and I am trying to strive for the best. We had an assignment to do, and it was just to look for covered services, Medicaid services in Florida. And I had the hardest time. Now, the reason why I'm doing the concentration in healthcare is because I really wanted to understand the business part of it. I wanted to build that acumen, so to speak, for being able to, as a UX designer, make healthcare more simple. I can't make it more simple if I don't understand the nuances, right, of healthcare. So we're doing this leadership leading through the bureaucracy course right now, and I have a deeper respect for people who can memorize and who just understand the different codes. And shout out to Kasan Ned, if you're listening or if you're watching this by any chance, shout out to you because you're one of the people that inspired me to say, okay, you know what? Yeah, even though as a UX designer, you may feel like you have a leg up because you don't really know much, so you can come in fresh. Nah, you got to know your stuff. And you, ma'am, you know your stuff, right? And so I have a deeper respect for those who understand all of the nuances, or at least enough to know all of the moving pieces, guys. The reason why healthcare is so difficult is it's twofold. On one side, I believe we've made it difficult. You have lobbyists, you've got political situations, you've got bureaucracy where there's a lot of red tape, and there's a reason why value-based healthcare, even though it's been talked about for the last 20 years, I thought this was something new until you actually do the coursework. You're going through and you're doing the research and you realize, wow, we've been talking about this for decades. It's now starting to kind of pick up a little bit of momentum. It's intentional. There are barricades that are in front of the progress that could be made. You've got people like Michael Porter. He's I would say, if Marty Neumeyer is the godfather of branding, then Michael Porter is the godfather of strategy, right? Individuals who have shifted their focus into trying to create and advocate for strategic ways of making healthcare better, right? Making it easier to understand. But here's the problem, man. Like I really, after doing the assignment, trying to find out just a simple list of services that were covered, I was frustrated. I mentioned the 4.0 and all of that because I have an academic mindset, right? I'm a researcher. So imagine somebody who's not doing a master's, who's not striving for any kind of a GPA so that they can be considered as some academic competitive candidate for a PhD program. That's going to be me soon. Like all of that, they're just somebody who's looking for Medicaid services. Now, Medicaid, as we know, and I'm just going to keep it really simple, are for those who are of a particular age and have a particular income, which is usually poor. Like it's a low income. Now, I'm not saying that if you have a low income, you're automatically, you have low education. But that's almost the reality, guys. The reality is when you look at a lot of the correlations, low income means that you're probably in a low income area. And most times, the majority of the times, if you're in a low income area, the education also isn't as supportive in that area. Man, shout out to my parents who, before I think redlining was a thing where they strategically put me in a middle school, so that when I finished the art program there, I was able to go to a school that was not in my district. It probably is in the district now, but it wasn't in my district. And I was able to go to a better school. The point is this, that there are barriers. And so imagine now, you've got somebody who is not trying to do any research. They're really, well, when I say research, not trying to dig that deep. It should be simple. We're in a consumerization era of healthcare where you just have your phone and you go through. And so let's say they go to Medicaid.gov, because that's exactly where they probably might go. And I'm going to go ahead and share my screen so that you can actually see this. So they're going to go to Medicaid.gov, and one second. Let's say, before they do all of that, let's say they put in list of Florida Medicaid covered services. Let's do it that way. How about that? Okay, so they put in the list, and then what shows up is hold up. I think I gotta switch between screens here. So there's the AHCA.myflorida.com, and that's for us. But let's say they didn't do that. Let's say they went through Medicaid.gov first, and you have this site, and this is one of my greatest frustrations with our public sites. When I see .gov, I shiver, I shudder, because design needs to meet the scientists. They need to meet the people together. Sometimes it's just, and I think Seth Turnoff talks about this a lot. He's a marketing, content marketing and healthcare strategist, and he does much more than that. But he was saying a lot of the sites, it's either too much designer and not enough healthcare specialists, or a lot of healthcare specialists but not enough design. I know that they're trying. I know that things are going to get better, but you go to Medicaid.gov and you're trying to now look for your state, right? Like what does Florida cover? I'm in Florida, and you go to Medicaid, and oh my goodness, there's so much to look at. There's cost sharing, quality of care, program integrity, eligibility, prescription drugs, long-term services and supports. It's overwhelming. Now, I haven't even checked this on the mobile site, but on the mobile site, I'm almost certain it's not mobile responsive. I can almost guarantee it isn't. And if it is, kudos.gov. But can you imagine that if it is mobile responsive, from a user experience perspective, how much scrolling people would have to do just to get to I just want a list. I just want a list of covered services. So now take a look at this. You see that I already have some that are already covered, because this is me now doing my own research, and this is just for school. Imagine somebody that really needs this in real life, not a hypothetical situation, and they're wanting to understand what's covered in my state. So you go to Medicaid and CHIP eligibility levels, or you go to performance, and this is me because I think before I went through this menu, I went through the Google searches, which landed me here. But let's say somehow you realize that you go to profiles and program features. Somehow you realize, okay, you know what? That's probably what it is. The language is so not esoteric, but it's so abstract that, you would think that there should be something in there that says by state, or some kind of language that helps you to understand that you can go to and maybe I'm not looking at it properly, because here it is right there, right? State overviews, state profiles. So maybe that's the way, but we're doing a preliminary customer journey mapping experience right now. The first thing that I go to is Medicaid. I didn't even check state overviews because it's right there, but let's go to state overviews then first. State profiles. That could be named so much differently, .gov, guys. Come on, CMS, y'all can do so much more with the language to help the simple person. I mean, the average age, the average reading level, I should say, is grade 6. So it's not by age, but by grade. The average reading level in America is between grades 6 to 8. Okay, so we go to state profiles. Now I like this because, you have the entire state. You can click on your actual state. You can search for your actual state. So I'm going to go ahead and click on Florida. You go to Florida and it takes you to Medicaid and CHIP in Florida. Cool. Florida has not extended coverage to low-income adults. Okay, what does that mean? There should be pullovers and rollovers where I can, just like here where it says CHIP, and I think that this probably was, it looks like it was a rollover at one point. I'm not sure, but it's underlined, where, we can understand and break some of this stuff down. Guys, y'all have to understand, the majority of the people in America don't really get this language. Heck, I didn't even really get this language until doing this degree. But the information here is great, right? It is amazing. We go down to eligibility in Florida. Okay, great. So this is the eligibility levels. Okay, cool. I'm still looking for a list. Enrollment. Still looking for a list. Like I'm looking for where is like, give me the list. Give me the list. I don't see it. I see metrics, national totals. Where is the list? Okay, quality of care. It's got to be in here somewhere, right? No. Child quality measure data, adult quality measure data, program documents of Florida. Okay, it's got to be here. It's got to be maybe in demonstration and waivers or managed care profile. That's the one that I went to before that was highlighted in the Medicaid piece right here, right there. So it's so difficult to find just a simple list. Now, perhaps it's difficult because there's so many moving pieces, so many different factors that need to be integrated. But I can almost assure you a simple list is not that difficult. And then you map. It's called information hierarchy, where you map the information from that particular service into, like you bake it into the actual link. So it's like, I'm going to use this again. So I'm going to say breast cancer screening. You can click on that and then you can have all the information about that. But at least I know that it's breast cancer screening is possible. It's covered in my state. Okay. Now let's say that you go ahead and you search for Medicaid services. And you decide to, you come across Florida Medicaid's covered services and HCBS waivers. Great. You end up on this site, Florida Medicaid's covered services and HCBS waivers. Oh, wow. Here's the list. Covered services. This is what I was looking for. Allergy, ambulatory, cardiovascular, dialysis, statewide inpatient psychiatric programming services. Wait, what? Now here's another problem. The problem here is we have these lists, but now there are other services that are nestled under those as well. They're nested or nestled, both nested under these. So if I'm looking for breast cancer, I don't see it. The B's, where is it? I don't see it. And the reason why you don't see it is because if you don't know, it's under radiology. You click on radiology, guys. And then you see bone and joint studies, diagnostic radiology, mammographies, in parentheses, breast. Even then, guys, the language, it's as if the scientists are the ones that are creating the website and the designers have been the one to try to piece it all together when it really should be a collaborative effort. And quite frankly, I think that's how the Bartley Group is going to start out. Maybe our first project. And then when I say our, it's really me. But then I'll find other people who are who have an in-depth perspective and understanding of healthcare, so that the me can be our, so that we can fix this. Let's make a simple list to start off with. Now there are websites out there like the Medicare Plan Finder. It's great. They tell you where to start. And you click on start here and it tells you, how to use it. Step 1, step 2, step 3. This is amazing. This is cool. But this is just about Medicare. Nothing's wrong with that. There are different plans or parts, I should say, of Medicare. There's part A, part B, part C, all the way down to part D, I understand. And the site takes a little bit long to load, maybe because there's just a lot of content. But here's the catch, though. A large part of this is about actually finding a plan. What if I'm not necessarily looking for a plan? I just want to understand this thing. I shouldn't have to go to Khan Academy to do that, right? There should be a dedicated site from our .gov or a company that will do that. Maybe that's what we start off first. The original goal of switching to mobile health was to do two things. It was to help CMOs to create a design system so that they can build and ship products faster, but it's also to tell better stories. This is the story. Medicare, Medicaid, understanding why it exists, who it's for, how it's going to help, what are the particular lists of services that are covered, what's not covered, and even maybe why it's not covered. I think that that's a story. So maybe that's where we begin, guys. And you can tell me, I don't think anybody's watching at this very moment, but the point is, I think this is where we start. Maybe the Bartley Group begins with UX in healthcare, beginning with just starting with Florida Medicaid's covered services, and HCBS waivers. Maybe that's where we begin. I'm just talking out loud here now, but the point is, as you're going through this customer journey mapping experience, now I'm like, okay, now great. So breast cancer screenings are available, but it doesn't even say screening, right? It's a mammography. Once again, we have to understand and know who we're talking to so that we can actually be able to effectively make all of this information valuable to them. There's a lot, like look at the cover. It's too long list, and nothing's wrong with that. I think that this is great. This is exhaustive. But once again, and it even tells you the eligibility. It's a great start. I think this is a leg up from Medicaid.gov. And I think the AHCA for Florida has done more of an intentional effort. Maybe intentional isn't the word, but I believe they had the user in mind, or maybe there is just a different group, a different demographic that thought about this. Because guys, there are other services here where there are laws that are put behind this, where for instance, with behavioral analysis and autism, there is a lot of things going on. And look at this, updates and resources. So the layout here isn't bad. It's just, okay, it's bad. There has to be a simpler way to create this information without it feeling so archaic. This stuff is for 2020, but we're putting it in a chart on a website that might not even be mobile responsive. You'll have to use your computer, your desktop, your laptop in order to understand this stuff. Okay, so I guess the rant is over. The point is this: I think that the best way for us to begin not even demystifying, because it's not a myth. It's real. Healthcare is complicated. To make it more simple, to continue keeping the patient in mind, to continue keeping the demographic of who the website, the particular language the product is for in mind. And it sounds so simple, guys. Like I said, because of going through this program, I have a deeper respect for those of us who know how to juggle all of the information and somehow are able to communicate it to patients. The problem is most of your websites, most of your brochures, your pamphlets, most of your how-to guides. I was looking for it. I went to a site that was actually really good, but it said, here's where you go to find a simple list, but it took me to the PDF. And I've got to scrolling through, and then in the PDF, there was a link underneath all of this information that then said, okay, here's where you really go to get the information. And then I had to click on that, and then it takes me to, to the list. But I'm like, man, why did I have to go through so many rabbit holes? Number one. Number two, why is it a PDF? We have to do better. We have to do better. And perhaps that's where those of us who have this passion and those of us who have this desire to make things simpler for the patient, that's where we come in. And I think that's why I haven't given up on this. While I do have this newfound, not resilience, but this newfound passion for speaking based on the anti-hero, people being the hero of their own story, learning how to reframe your narrative so that you can live on purpose again. That's all great. There's still a soft spot in my heart for healthcare and healthcare made simple, for user experiences, for patient experiences where people can come and just get what they need and be out, right, guys? So anyway, that's what this, I guess, kind of preliminary case study / rant / show and tell is really all about. There are so many different ways that we can do better. And maybe I'll start there. Maybe that's what we end up doing. Maybe the Bartlett Group really begins to relive its purpose of making healthcare simple. And I'm not going to change the providers' structure of how they, I'm not going to change hospitals and how they use EHRs or the EHRs that they use. At one point, I thought that that's what I really was capable of doing, but you need a huge sales force for that. And it's going to take years. The sales cycle is ridiculous. Shout out to Seth. He really opened my eyes, not even just to that, but even to doing something even smaller, at a smaller scale. The sales cycle for trying to impact huge provider networks you got to start small. And the way that we start this is with what people are already using. They're using their phones, guys. Like they're using their tablets. You know, they're using their thumbs. They're scrolling through, and a lot of people probably selected their new plans, from their mobile devices. All right, so that's that. Let me know what you think, and be on the lookout for more content like this. I think so far we've got about 4 buckets, 4 categories that we're dealing with. So healthcare, UX healthcare. We're dealing with brandable minutes. So, branding, branding pieces. I still got my little black book here. So we're dealing with that. We're also dealing with, I think, general content, inviting people to speak on how they're able to be successful, or just ideas or thoughts about even just kind of, you know, uh, being productive, or whether if it's time management, or maybe even design, or whatever it is. So there's that bucket. I think it's kind of like the miscellaneous bucket. But then the fourth one is sketch a strategy. I have not forgotten about sketch a strategy. We are going to be doing more of that. That one is more people oriented, though. I have to connect with others. I could easily just take like the McKinsey framework and some others and literally sketch those out and try to apply those in real life. But I think that the whole goal of the sketch strategy is to do it live with somebody else. It showcases what they're working on. It showcases my own talent to be able to listen and to kind of frame things in a unique way. So yeah, so those are the 4 areas. So be on the lookout. We're going to have more content for sure. We're going to have more content. I'm going to have more content for sure. And I'm excited. I'm excited. We're in a new season. The year is not over, guys. The year is not over. Just take it one day at a time, one step at a time, and we'll make it together. I'll see you guys in the next one.